Welcome. I'm Kelly Mitchell. I am the Residency Program Director of the Ophthalmology Residency at the Texas Tech Health Sciences Center University in Lubbock. We're talking today because of the really unprecedented impact that the COVID pandemic has had not only on all of our society, I'm sure everyone listening to this, your education, the life of your loved ones and friends has been significantly impacted, like ours here in Lubbock. Certainly as a medical student interested in ophthalmology as a career, you're aware of the decision made that there will be no on-site interviews for applicants this coming fall's interview season. And so I think the programs, myself included, have looked at ways to better inform you of our program. And so what I'd like to do today is give you a little video introduction of our program. To start, who are we? We're a 4 resident per year program. This year, we have an exciting addition. We've been approved for the joint internship in which our interns will do their internal medicine internship here, and then the last 3 months of their internship, they will become our residents. So the residency used to be 36 months. It's now 39 months, which I think both our program and certainly nationally, this is viewed as a really clear positive because you get more hands-on time to learn the skills to become an ophthalmologist. Our mission is really this. It's to produce comprehensive and contemporarily trained ophthalmologists. What does that mean? That means you're going to graduate with the skills to practice ophthalmology with modern techniques. We also want our graduates to develop an effective, self-driven learning style so that you can obtain and maintain your board certification, but equally important, learn how to grow and advance your skills as medicine advances during your career so that you can always offer evidence-based and contemporary care to the patients throughout your entire career. Our culture, I think, the pillars of our culture would be accountability and authenticity. I think we operationalize that as a residency to really focus on a resident-centric and a patient-focused culture. We want to treat our residents as colleagues. What are the resources that we do that? I think Lubbock and Texas Tech has a unique environment. We have supportive hospital partners, and we have a diverse and committed group of faculty educators. We're well represented across minorities regarding men and women, age groups of faculty. If we look at the locations of where our residents will spend their time, the main clinical experience is in Lubbock. And in Lubbock, you'll do your main clinics as a first-year resident here at what we call TTUHSC, and that's the abbreviation for Texas Tech University's Health Sciences Center. Physically connected is our main teaching hospital, University Medical Center, which is the level 1 trauma center of the region. And if you're looking at a map at Texas, the region would be the Panhandle. What's the general design of our residency? First-year residents, as medical students, certainly you've worked hard to learn an eye exam appropriate for a medical student. But your first year of residency, you will learn the eye exam appropriate for a practicing ophthalmologist. You'll take primary call. You'll also learn office-based procedures, injections of medicine into the eye that we use for diabetic retinopathy and macular degeneration. You will do eyelid surgery. You will also present talks at Grand Rounds. During the second year, you will then advance and do intraocular surgery in the OR. During the second year, the schedule is designed where at least once a week you will be in the OR with a faculty, whether it's doing retina surgery, pediatrics, or cataract surgery. And then as a senior resident, you will have a cataract surgery rotation every week of your entire senior year. We find that's important so that you have a cohesive, consistent exposure to cataract surgery. Now, sometimes the cataract surgery rotation will also have a theme of corneal surgery. It may also have a theme of glaucoma surgery. The reason cataract surgery is I think a main theme of all comprehensive ophthalmology experiences is because if you look at the ACGME website, right, which is the accreditation body of residencies, the highest number of procedures that you have to, the minimums they call them, that you need to obtain to graduate residency is in cataract surgery. Number is 86, far greater than all of the other procedures that will teach you how to do. That's because cataract surgery is really the most complex surgery that a comprehensive ophthalmologist has to graduate feeling confident to perform. Another item I'd like to talk about as far as outcomes is what's the experience of our residents after graduation? I think in ophthalmology there are really two paths. One, the resident who strives to have extra training regarding fellowship education, and two, those that go out and practice comprehensive ophthalmology. I think in both those choices, the residents that graduate from Texas Tech are very competitive, seeking the fellowship that they want or the attractive job offer that they want. We track that, and since really the last 15 years, since before I was program director and the last 13 years since I have been program director, every single resident that has applied to fellowship has matched. And the residents that have sought their first or second choice job as a comprehensivist have been offered that position. So we're very pleased that our graduates are viewed competitively both by other academic centers when they seek fellowship and by our busy, caring community partners who want to add a confident and caring comprehensive ophthalmologist. I don't want you to look at our residency, nor hopefully should you look at any residency through only the lens of the COVID pandemic. But I think it does serve a useful tool to understand change and resident centricity, if I can use that term. So how did we take our residency and adapt it to the COVID experience? I think the first thing we had to just be honest with everybody was we needed to make sure our residents were safe. So we redesigned our whole clinic schedule, and I have to say, with great help from my engaged chief residents who recently graduated, we came up with a really neat rotating schedule that had our residents on a week, off a week, covering the hospital on the third week, so we really minimized our risk of cross-contamination or exposure. We altered our lecture style. We still kept our educational curriculum. I myself got to learn Zoom, and I think that little disruptive experience really helped us. We were able to include more community ophthalmologists than we normally would have. They asked insightful questions. They were more connected to the residency, so I think that was an exciting addition that we didn't expect when we were confronted with not being so close together. I want to reassure all of you viewing this from points all over America that we're all in this together. That as disruptive and it may be mildly anxiety-provoking as this is for you, I think for us on the residency side, we're also a little bit anxious about how we're going to do this in a new way. Please email me with any additional questions, and I wish you the best of luck. And ophthalmology is without a doubt the best career choice that you could make. Good luck.